So, I am going to give you a scenario. This is a real life scenario about an individual that I am treating in my clinic. And I would um, welcome any advice, any medical advice, any suggestions, any recommendations regarding this individual. So, this individual is a 69-year-old black female. And she came into my clinic approximately 2 days ago with complaint of swelling and itching to her face. So basically, approximately 20 days ago, she fell and she lost consciousness and she fell. And when they took her to the emergency room, her family took her to the emergency room. They had said that she had a seizure, which is new onset. So while there, they did the X-rays, they did the CT scans. Um, they didn't really find anything. They just basically said she had swelling to the right side of her face, and on the CT scan, it just actually showed the fluid collection to the right side of the face, and the radiologist gave a possible diagnosis of periorbital cellulitis. So while there, the ER doctor started her own Zyrtec, and he started her own Keflex for the cellulitis. They also started her own Keppra, 500 milligrams twice daily. So she went home, she started taking that. She went back to the emergency room 2 weeks later, stating that the swelling had increased to the right side of her face, and now she was just kind of itching all over. They did an MRI of her head, then face and head. And just basically, they didn't see anything different, just saw the swelling. So they suspected that it may have been the Keflex. So they stopped the Keflex, but because they still suspected um, possible cellulitis, because her face was stretched up from when she fell and hit her head. So they stopped the Keflex and they started on clindamycin. And of course, she was already on the Zyrtec which was supposed to be for itching. And they sent her back home. So she then came into my clinic, let's say 5 days later, and the swelling had spread it to the left side. And pretty much her face was really swollen and reddened. Her eyes were nearly closed up. Like I said, skin had been. I think she had irritated and rubbed the area so bad that it had kind of the the skin had kind of peeled off a little bit. But when I saw her, she said it was actually better. It was worse than that, and she attributed the itching and the skin irritation to. They gave her a triple antibiotic ointment to use, and she said she had been applying that to her skin, so it wasn't as bad as far as peeling and red, but it still itched. So that's my conundrum. Just trying to figure out what's going on with her because they suspected the Keflex, so they changed the Keflex to the clindamycin. So of course, my intuition was to zero in on the Keppra, but according to her, she was already on the Keppra before the itching started. So she didn't suspect it. She didn't want to believe that it was the Keppra, and she didn't want to stop the Keppra because she was scared that she would have more seizures. So what I did is I asked that she brought in all her pill bottles. So she still had the Careflex pill bottle with a few Careflex pills still in them. And she had the clindamycin and she had the Zyrtec. So, and just a little background on her and history on her. She also has a history of high blood pressure, high cholesterol, moderate depression, iron deficiency, anemia, and the medications that she was on, other than the medication that was started at the ER, included amlodipine, 10 milligrams once daily, atorvastatin, 80 milligram once daily, Wellbutrin, 100 milligram once daily, Plavix, one tablet daily, uh, Diazide, 37.5 slash 25 daily, and ferrous sulfate, 325 daily. Also, aspirin, 81 milligrams daily. The Plavix was actually because she had CVA, cerebral vascular accident. Okay, so those were but none of these medicines are new. She's been on these medicines for a while. Also of note, she had came in and saw her regular primary care doctor like a couple of months before, and she was complaining of headaches, severe headaches. So her primary care doctor had referred her to a neurologist, but she had been unable to make the appointments. They had been canceled twice without her having gone to the appointments. So I did. I drew because it was right there at the moment. And also of note is that pretty much they had drawn lab works on her while she was in the emergency room, and all her blood work was fine. It was nothing like out of the ordinary per se. Her cholesterol was still a little high, like in the low 200s, but as far as her kidney function, liver functions, things of that sort, they were normal. Also of note is that she did admit to that she used to drink a lot up until 1 year ago, but she refused to call herself an alcoholic, even though she did admit that she drank pretty regularly, even though she said it was not daily. But when she, in her words, when she drank, she drank. Okay, so because from what I could see, her main issue was the swelling, generalized swelling to her face. No respiratory distress. What I did, but she was itching. She was just kind of like rubbing and patting her head because the scalp was itching, and that was the main thing for me. She was just itching all over. So I wanted her to stop all her medicine, but she refused to stop the Keppra. But she did agree to stop the clindamycin and the Zyrtec. And what I did, I gave her a Benadryl shot, and I gave her some Decadron, 4 milligrams. And I drew some blood work. Blood work has come back since then. And I just basically did a CMP, CBC, ESR, CRP, hepatitis panel because she has a history of alcoholism. My words. Um, I did just I did all of the no previously she like 3 weeks before she had other blood work done like vitamin B12, folic acid, thyroid level, and they were all normal. And pretty much with all the blood work was normal that came back that I had drawn. Nothing really out of the ordinary. Um, yeah, I think so. Hepatitis A antibody was positive, but the antigen was negative. Otherwise, the Hep B and Hep C tests were all non-reactive. So that was the only thing out of the ordinary for her. And I haven't seen her back yet to address her labs and see how she's doing. But I just wanted to, uh, based on the information that I've given you, I welcome all advice, all recommendations, all input coming from medical professionals, doctors, nurse practitioners, physician assistants, nurses. um, pharmacists. I welcome all input regarding this. Just let me know what you think. You can just write it down in your comment in the comment section. What do you think I should do? What my next move should be? What other tests or images need to be done? Um, just let me know.